Good afternoon, everyone. My name is John Edmondson. I'm the MSK Clinical Lead on Physioline. I'm very proud to be introducing the great work around musculoskeletal input into post-mastectomy care that the Women's Health Group of Physioline have been doing. Breast cancer is the most common cancer in the world, worldwide, with nearly 1.7 million new cases diagnosed annually, 55,000 new cases diagnosed in the UK every year. This represents about 12% of all new cancer cases and 25% of all cancers in women. It's the fifth most common cause of death from cancer in women. Breast cancer risk doubles each decade until menopause, after which the increase slows down. However, breast cancer is more common after menopause. Survival rates for breast cancer vary worldwide, but in general rates have improved because breast cancer is diagnosed at an earlier and localised stage in nations where populations have access to medical care and have progressive improvement in treatment strategies. Although there are some risk factors associated with increased risk of developing breast cancer, the only true risk factors are being female and getting older. Now, BUPA itself refers around 700 women for mastectomy following breast cancer every year, and the Women's Health Group raised concerns that some patients were accessing Physioline with MSK symptoms following surgery. Although their breast cancer diagnosis had been fantastically supported through oncology services, the aftermath of mastectomy surgery had been less supported in order for them to achieve full range of movement and function of the affected shoulder, scapula, thoracic spine and anterior chest. In many countries with advanced medical care, the 5-year survival rate of early stage breast cancer is 80 to 90%, falling to around 24% for breast cancer diagnosed at a more advanced stage. The UK is 6th in the world for numbers of diagnoses of breast cancer, but only 8th in the league table for breast cancer survival rate. And through more multidisciplinary approaches and support, we hope we can be part of providing improved MSK post-mastectomy care to more and more women affected by breast cancer. So I'm going to introduce you to Laura Windle and Abigail Glover, who are two members of the Women's Health Group, and they're going to introduce all the work that is ongoing at the moment in Physioline.
Okay, hi, my name's Abby. So I'm one of the MSK physiotherapists on Physioline, and I'm going to talk to you about the types and stages of breast cancer and the surgical options that are available. So firstly, the 5 stages of breast cancer that we've looked into are stage 0, which is carcinoma in situ, which we'll go into in a little bit more detail in a minute. Stage 1, which is a cancer that hasn't spread outside the breast. Stage 2 is a tumour which may or may not spread into the lymph system. Stage 3, there is a tumour present and that has always spread into the lymph system. And in stage 4, the cancer has metastasized, so that would be into bone, lung, liver or brain. So the 3 types of breast cancer in situ are the ductal carcinoma in situ, which is within the ducts of the breast tissue, which you can see on the diagram here. It is the earliest and most common form of breast cancer. In lobular carcinoma in situ, the cancer is in the breast lobes, which are the glands that make the breast milk, which are also shown in the diagram here. And then there's the Paget disease of the nipple, which is quite rare. It's quite a rare form of cancer and affects the nipple and areola area mainly. So surgery will vary depending on what stages and what type of cancer it is. So the surgery might involve a sentinel node biopsy to start with. It checks whether the cancer has metastasized to the axillary lymph nodes. The sentinel nodes are just the first nodes that receive the drainage from the tumours, and the axillary dissection may be carried out as a result of this. A lumpectomy or partial mastectomy may also be performed depending on what they find from these results, and that's the only other breast conserving surgery available. So then we move on to total mastectomy, where the breast tissue, nipple, areola complex and some skin is removed, or the modified radical mastectomy involving the same removal as mastectomy but also includes the fascial lining of the pectoral muscle along with the axillary lymph, and then the radical mastectomy, which involves the pectoralis major and minor muscle removal as well. So chemotherapy and or radiotherapy may also be used in conjunction with one of these surgeries. So complications that could come from these surgeries and treatments that we've found are pain and tightness from scar tissue, cording, lymphedema, loss of range of movement or instability at the shoulder, postural weakness and deformities, and then nerve damage, which may lead to loss of sensation and weakness in the associated arm. So chemotherapy and radiotherapy can have similar side effects to these as well. So looking at the exercise side of things, we've looked into exercise because we've found that it can prevent shoulder stiffness developing and help people regain full movement and function of the shoulder. The exercises also encourage circulation and therefore help the scars to heal faster. They can help to improve any symptoms of tightness and cording, which, as we know, is a side effect of surgery or radiotherapy, or can be. They help to reduce the risk of lymphedema, and if needed, the exercises can help people achieve the required shoulder positioning for receiving their radiotherapy post-surgery. So we also know, as practitioners, that the limited shoulder motion have adverse effects on patients' daily activities and lives. So things such as reaching overhead, getting things out of cupboards, fastening clothes from behind could all be affected by this kind of surgery and scar tissue involved. So exercise compliance can be a bit of a barrier to recovery. So we've developed this protocol to try and help patients that they can do in their own time, in their own homes, just to make it a lot more convenient and help with that compliance. We recommend the amount of exercise that you do is 5 repetitions of each exercise, which we'll go over in a minute. Practice it for about 4 times a day. It shouldn't be painful. When you do the exercises, you might feel a bit of stretching or pulling, but that's pretty normal. You should move as much as you feel able. The more you do the exercises, the easier they should become. So how long would you do this for? Like what time period is another question we looked into. And arm stiffness and weakness can persist for some time following surgery and radiotherapy. So it's important to exercise quite regularly with this. So if the patient has just had surgery, you keep doing the exercises until the shoulder movement has returned to normal or as best that they think it's going to be or as it was before surgery. If they're going to have radiotherapy, they should keep doing the exercises throughout the radiotherapy and then for as long as they can after the treatment's finished until they're back to a decent range of movement, full if possible. The radiotherapy, just while we're on that note, usually the position that might be asked for is a full external rotation and abduction, end of range abduction as well at the shoulder. So it's quite an extreme range of movement if there's any scar tissue around there. So there's lots to work on. So the exercises that we've found, there's lots, but we've put a few of our kind of favourites on here which we think might help. So the first one is the shoulder flexion without gravity, so just helping with your reaching upwards. The second one is the shoulder shrug, helping with posture that we mentioned can be affected, especially with nerve damage. And the shoulder blade squeeze as well could help with the posture, and also in quite a lot of these patients, if there is nerve damage, you can get scapular winging as well, so it could help with that. Shoulder internal rotation can help with fastening clothes from behind, so with ladies that can help with fastening bras. And assisted shoulder flexion is the next exercise. And that one again is just helping you reach up towards cupboards and just getting things off shelves, things like that. So the last 2 exercises, the butterfly stretch is a really good one for the radiotherapy position. That will just help with all the scar tissue that's come from like the breast, surgery. And the latissimus dorsi stretch as well is kind of a different way of doing it, getting into that position and stretching kind of down the side of the body as well with that one. And the final exercise is the bench slide. So you can do this in various ways. You can do it using like a towel, you can do it using a ball, or just do it along the surface of the table just to stretch out forward and just help with any reaching again.
Thanks, Abby. So we're just going to come on to a few more of the complications now. So one of the big things that we see kind of post-cancer treatment in patients is lymphedema, quite a common complication. But what actually is it? So it's basically it's visibly swelling, usually in the limbs, predominantly upper limb, what we're looking at from a breast cancer point of view. It's that build-up of excessive fluid caused by either physical blockage in the lymph vessels or failure to function as a drainage system. So the lymph vessels can often be damaged during your treatment or even potentially removed during surgery if the cancer is spread. Going back to what Abby was saying before about the different stages. So that can be also damaged during radiotherapy, which is causing scarring during the treatment. That's going to narrow the vessels, making them less efficient as a drainage system. So if you think about stepping on a hose pipe, how that's affecting the flow. There are two different types of lymphedema. We've got the primary, which is more of a rare genetic disorder, not very common, not predominantly what we're going to be expecting to see with our patients. We're going to be falling more under the secondary, which is physical damage to the lymph vessels. That's a lot more common, and that can affect around 2 in 10 breast cancer patients. So quite a large number of patients potentially coming through. So what are the symptoms of lymphedema? Excessive swelling is obviously one of the main things that you're going to see, as you can see from the picture there. That can cause often an achy, heavy feeling in the limb, difficulty with movement, tightness and hardening of the skin. Occasionally that can then cause folds developing. As you can imagine, that can be a breeding ground for bacteria, quite increased risk of infections such as cellulitis, and potentially growth developing on the skin. And in extreme cases, you can actually get some fluid leaking through the surface of the skin there as well. So what can we do about it? What are the treatment options? Unfortunately, there's no outright cure for lymphedema. A lot of what we're going to be looking at is management strategies and things that the patients can be doing to manage that condition more effectively themselves. So one of the big things that is really, really useful for lymphedema is massage. So that's all about stimulation of the flow of the fluid manually. Unlike with your heart circulation, there is no central pump for your lymphatic system. So we are relying on a lot more other structures around that to get that fluid moving. Exercise, again, we're getting that pumping system. So exercise is important, especially in combination with the compression. So things like bandages, sleeves, gloves, fitted over a limb act as a counterforce to the muscle to stimulate more drainage, and then combining with the muscle movement, getting quite useful to drain that fluid away, and postural drainage as well, allowing gravity to take a little bit of the load and help out there. So we're going to talk a little bit next about cording, which is another common complication. So cording is a common term that we use. It can also be called axillary web syndrome, axillary cord formation, or lymphatic cording. Why does it happen? We're not really sure. We do know that it can develop as a side effect following lymph node biopsy or lymph node dissection, and we think it's due to the scar tissue from these procedures that's then compressing on blood vessels, lymph vessels, nerves, leading to inflammation and scarring, and eventually hardening of that tissue. This hardening can spread down the fibres of connective tissue in the form of those tight cords. It can actually spread often quite far away from your surgical site as well, so it can come down into the forearm, into the hand in extreme cases. So again, there's a little bit more research that needs to be done into why that actually happens, so that we can potentially try and prevent that. In terms of how many people it's affected, the numbers and the research vary massively. So anywhere between 6 to up to 72% of women could be presented with cording, and that can happen at various different points, from a few days right the way through several months down the line. So as you can see on the picture there, that's obviously quite an extreme case. You don't always necessarily see the bands. Sometimes it can be more of a feeling that the patient's reporting. of a web of thick rope-like structures underneath the skin. So again, it's also listening to what the patient's reporting, not just physically looking. And that can sometimes be that they're only feeling it on certain positions. So they might first notice that when they were doing things involving raising their arm over the shoulder or above the head before they're actually aware of that. So again, it is just being aware of what the patient's reporting to you. So what can we do to try and help with cording? There's quite a few things. So again, stretching and flexibility exercises. Some of the exercises that Abby mentioned there are important just to try and get those tissues moving. Manual therapy, moist heat, pain medication, more of the laser therapy, so coming into the electrotherapy, and also massage, as we mentioned, with the lymphedema. So that can be, again, something that can be followed up frequently throughout the patient's recovery. So what's the prognosis with cording? Generally quite good. Most patients, if they are being compliant, will see an improvement. But the main message to hit home to people is that they need to be doing this consistently. So not just for the first couple of weeks, doing them for a prolonged period of time. And, it's never too late to start, really, to get on with the exercises. As we mentioned before, these symptoms may present later down the line.
Okay, so I'm just going to talk briefly about the massage that can be used over the scarring that we have mentioned. So, as we already know, the massage can be very effective following surgery. It can help with the healing process, aid to improve the range of movement and function of the affected arm. Massage should only be started once the scars have sufficiently healed and once the stitches are removed. This can vary between surgeries, but averages between 2 to 4 weeks post-surgery. So when massaging the scar, use the tip of the fingers, so the second or third fingers, and gently apply pressure to the scar area and the surrounding tissue. It can be done using different directions, so we've got a diagram here to show what can be done there. When performing the massage, apply pressure that is comfortable and try to sustain the pressure for 30 seconds to 1 minute. Then, if able, gently increase the pressure as you can tolerate, or the patient can tolerate. If the area was to become sore, then ease off the pressure, and that should alleviate some of the symptoms quite quickly. Continue massaging for up to 10 minutes or until it becomes quite sensitive, in which case you can stop before that, and you'd repeat it sort of 2 to 3 times a day. It should be fine. It's important to avoid any massage if the scar begins to feel inflamed. You can use lotion to help moisten the scar and keep it flexible, but have a word with a radiotherapy practitioner because some creams or moisturisers might not be safe to use during treatment. So when wouldn't you massage a scar? Firstly, if the skin is broken, so it could cause inflammation, could cause infection and reduce healing time. The signs of infection that you would be looking for is any swelling and redness of the skin, pain and soreness where you have had the treatment, feeling warm to the touch in that region, any fever or chills, general feeling of unwell, the patient feeling unwell and headachy or tired and run down. Any signs of pain you're looking for, and if the scar is openly bleeding is the third reason you wouldn't massage it.
So when it comes on to massage for lymphedema, it's a little bit different in terms of your technique. It's more about gentle massage, just trying to drain some of that fluid away, so less pressure than what you would be doing with your scar. And you'd be looking at using more of the flat of your hand in order to push that fluid away. We're always going to be looking to make sure that we're positioned comfortably, whatever's comfortable for that patient, and making sure that we're trying to reduce the muscle tone, and massaging away from the area that's been treated for the cancer. So again, a lot of the time we're going to be moving that more centrally, keeping that soft hand nice and relaxed, light pressure to the skin. You can feel the muscle tissue underneath the skin, and that is too much pressure. You just want to be quite a light touch. And it's recommended that massage is done daily to help with the lymphatic drainage and aid the recovery there. So you can see on the picture slightly different hand positioning depending on which area, whether we're coming through the neck, into the armpit, or across the chest there. So the precautions, similar to what Abby's mentioned, so the big one is pain. Again, with the lymphatic massage, it is going to be a lot lighter touch, and obviously the signs of infection. You know, as we're working in and around the lymphatic system, we don't want to be encouraging that to travel elsewhere. The benefits of massage, releasing tension, again, thinking about the muscle tightness around there, reducing pain, scar tissue mobilisation, reducing the swelling, and then reducing stress and promoting relaxation more from the patient's point of view. There are a couple of links on there to YouTube videos for anybody that does want any more information or guidance on massage techniques rather than us going into the ins and outs. They are quite useful videos, so if anybody does want that, they are showing on the slides. Alternatively, if you did want any more information, we can pop that through on an email for you at a later date. And thank you for listening. If anybody did have any questions about anything that we've discussed, we have put the PhysioLine email address on there. If you want to pop us a line on there and just title it Women's Health, then myself or one of our colleagues can certainly pick that up. We are also putting together some of the exercises that we've gone through as a physiotech protocol. So again, for anybody in clinic that might want to be looking at that or use that information to pass on to patients, we will make that available on PhysioTech for everybody. Thank you very much.